wait, are you starting?
Yeah. Okay. Here's my tools. Jessica's gonna film it for us. Lexi's watching. Hi. Put on the ceilings. Okay.
Oh, my goodness. Come in.
Hi, my name's Bailey. I'm gonna be your student nurse today. Could you say your name and date of birth for me?
Caitlin Monsager, 410 of 99.
Perfect. Let me just see your wristband. Awesome. How have you been feeling today?
Pretty good. Slight headaches, but
Slight
nothing bad,
headaches?
Yeah.
Okay. When did those start?
Yesterday.
Yesterday? How long do they usually last for?
Normally a couple of hours, but I've been pretty stressed, so.
Okay. Does anything like alleviate the pain? Like what do you do to
Tylenol helps.
Tylenol? Do you take any naps or anything to help or?
I haven't had time.
No? What kind of pain is it?
It's just this like mainly dull pain, but then like it'll get sharp. Sometimes it'll just be like really quick.
Okay, and where in his like front?
In the front, yeah.
Right in the front. Okay. Well, I'll keep that in mind when I do your assessment today. So it's only going to take about not even 30 minutes. I'm going to do a head to toe assessment. I am going to be moving your joints, your limbs, so just let me know if anything hurts, if anything is tender, and I'll stop and we can take a little deeper look into it. Does that sound okay?
Yep.
Do you have any questions or concerns for me so far?
No.
Okay. So first I'm just going to go through a quick health assessment or health history assessment. Do you have any chronic current illnesses that you know of right now?
No.
Okay. Do you have any past illnesses that you know of? Do you have any family chronic illnesses such as cancer, diabetes,
My
cholesterol?
grandparents have some cancer.
Okay. Is that on your mom's side or your dad's side?
My dad's.
Do you know what kind of cancer it is?
Prostate and ovarian.
Okay. I will write that in your chart. Do you take any medications?
No.
No? Okay. So next I'm going to start off with just a mental awareness kind of test. So I'm going to ask you just some random questions.
Okay.
They're going to sound really random. Just answer to your best abilities, okay?
Yeah.
So do you know where you are and why you're here?
I'm in the CPR room for a head to toe exam.
Perfect. Do you know what day of the week it is?
It is Tuesday.
Okay. And do you know who the current president of the United States is?
Joe Biden.
Perfect. So this test just kind of tells me that you're mentally aware, you're here, you know where you are, and because you're having conversation with me, I can tell that your hearing is fine, you're speaking clearly. So I'm just going to go straight into the assessment now.
Okay.
Okay. So you can just uncross your legs for me. I'm going to start with your head. I'm just going to kind of feel around. If anything feels tender here, let me know. Does this aggravate your headache at all?
No.
Okay. So I don't see anything there. I'm just going to look through your hair. I'm looking for any lesions, any lice, which I don't see any. Have you had any changes in your hair, nails, or skin at all?
No.
No? Okay, that looks good. I'm going to palpate. Well, that means feel. I'm gonna feel around your head, your joints. Feeling your lymph nodes. Nothing tender or sore here?
No.
Okay. I'm just gonna feel around for your temporal arteries, just make sure those are okay. I'm gonna check for the pulse too. Okay. I'm gonna have you open your mouth for me and close. Does that popping hurt at all?
No.
Okay, can you move your jaw side to side? Does that popping hurt at all?
No.
Okay. Perfect. Now I'm just gonna take a quick look around. I'm gonna bring my pen light out. So I'm just gonna look at your eyes, nose, mouth, and your ears.
Okay.
I'm gonna start off with your eyes. I'm just gonna check your pupillary responses. So just look right at my nose. Have you had any changes in your vision lately?
No.
Okay. Do you wear contacts and glasses?
Yes.
Do you have your contacts in right now?
Mm-hmm.
Okay. And if you just take your mask down for me real quick, you look up. I'm just gonna look in your little nose. Okay. And if you say ah. Have you had any sore throats lately? No. Can you stick your tongue out? Okay. Thank you. I'm gonna look into your ears. And your lips looked good. They looked moist. I didn't see any cracks or anything. Have you had any problems with your hearing lately?
No.
Any tenderness when I palpate or feel?
Nope.
Look into this one. Okay, I'm not seeing any drainage in either of them, and if they're not feeling tender.
No.
So now I'm gonna have you follow your eyes with this pen.
Okay.
Don't move your head, just your eyes, okay?
Okay.
Okay, I'm gonna go in and out. Perfect. That looked really good. So I'm gonna actually do another assessment of your eyes real quick. I'm just gonna kind of feel around, make sure I'm not feeling anything. And I do see that your eyes, your pupils are round, which is good. They look pretty clear, which is also really good. So if you just close your eyes for me, let me know if any of this is tender or if it hurts at all. No?
Nope.
Okay, look at me. I'm gonna look in your eyes. I'm just checking for, drainage, anything out of the ordinary, which I don't see. Everything looks good. Okay. While I'm here, I'm actually gonna feel your sinuses. So I'm feeling both your maxilla and your front sinuses right by your nose. Any tenderness here?
Mm-mm.
Besides my pressure, nothing hurt.
No.
Okay. I'm gonna take my gloves off. Okay. So next, I am going to do a quick hearing test on you.
Okay.
So what I'm gonna have you do is plug one ear. I'm gonna whisper something into this next ear, and you're just gonna repeat it out to me.
Okay.
Okay.
Yellow.
Okay. And the other ear.
Rhinoceros.
Awesome. Okay. So everything seems pretty good. I'm gonna now move on to your neck.
Okay.
So what I'm gonna have you do is I'm gonna have you look this way. This way. If you can look up, chin to your chest. Can you do ear to shoulder on both sides? Okay, was any of that painful or anything?
No.
No stiffness?
No.
Okay, so now that we did that, I'm gonna add some resistance to it just to test your muscle strength.
Okay.
So if you could put your head against it, okay, on this side, and then I'm gonna put on this, if you could do head to shoulder, head to shoulder. I'm gonna do this resistance and then back resistance. And that all looks really good. So I'm gonna move to your neck. If you could just look up for me. I'm gonna move this up just a little bit. I'm just gonna feel around. Does any of this hurt?
No.
I'm just checking for swollen lymph nodes. If you have anything sore here. Which I'm not feeling anything. I'm gonna now move some of so it's your trachea and your thyroid that I'm looking for.
Okay.
I'm gonna move this to the side. Feel around. Move this to the other side, feel around. Anything hurt here?
Mm-mm.
I'm not feeling anything swollen either, so that's good. I'm gonna hand you this water. If you could take a drink, hold it in your mouth,
Okay.
and I'll tell you when to swallow. You look up for me. Okay, can you swallow? Okay, was there any pain or discomfort there at all?
No.
Oh gosh, okay. So now I'm gonna feel for your carotid pulses. Just relax, there should be no pain here. Do one at a time. Okay. Okay, those look good. They don't have any boundingness to them, so that's a good quality.
Okay.
So I'm gonna do your shoulders and go down to your arms now.
Okay.
I'm just gonna feel around. Any of this hurt?
Mm-mm.
No. I'm gonna move to your arms. I'm just looking for any lesions, make sure nothing's hurting. Have you had any issues with your bones or joints lately?
No.
Okay. So I'm seeing you don't have any lesions. Your hair distribution looks good. Your turgor looks really good as well. And your skin color is an even color, which is good. Just gonna look at your hands, feel your joints. Your fingernails are round. They look very hygienic also. They look good. I'm gonna check for capillary refill, which looks good. It's under 2 seconds. And then if you could just go like this for me, I'm just gonna check for clubbing real quick. Perfect, I don't see that at all. And then I'm gonna test for strength. If you could squeeze my fingers. Beautiful, so strong. Okay. So I don't see anything too big, I see a couple moles here, but they don't look anything out of the ordinary. I'm gonna check a couple pulses now. So I'm gonna check your brachial pulse on both arms. So just relax. Okay. And this now. Okay, and then I'm going to go down to your radial pulse. Awesome. I'm not feeling anything out of the ordinary. They're all very symmetric. Okay. I'm going to do a couple reflexes.
Okay.
I'm going to do one up here, and then I'm going to move down to your legs and do one.
Okay.
So I'm going to do one on the back of your elbow. You can just relax. I'm going to find it real quick. Awesome. And then this arm. Okay, relaxing. I'm going to do that one again. I didn't see it. Did that one hit? Okay. I'm going to go down to your knees now. Okay, if you just look up at the sky for me. Did that hurt? No. Okay. Okay. Those look good. You're very reactive, so that's good. Okay, the last thing for the arms I'm going to have you do is if you'll spread them out for me, and if you can touch your nose, perfect, and then your other one, and then just one more time. Awesome. And then you can relax your arms. If you could touch my finger with your finger and then touch your nose. Yeah. And the other hand. Beautiful. So I'm now going to move down. I'm going to start listening to your heart and your lungs.
Okay.
I'm just going to start by feeling around on your chest, make sure I don't feel anything. I also don't see any lesions or anything, which is good. Have you had any lumps or anything that you've noticed in your chest area?
No.
Okay. Does any of this hurt?
Mm-mm.
Have you had any problems with breathing at all?
No.
Okay. So this looks good. I don't feel any lumps, masses, and if you're not having difficulty breathing.
Mm-hmm.
So I'm going to start by listening to your heart. I'm going to go down. I'm going to ask you to lift your breast. I'm going to listen. I'm also going to feel pulse down there, and I'm just going to come right back up.
Okay.
And then we'll listen to your breathing sounds.
Okay.
Okay. So I'm going to listen with this side first, and then go to this side.
Okay.
So just relax, breathe normally. Okay. Okay. Okay, and if you would just lift your breast for me, just real quick. This one down here. I'm going to flip this. I'm going to take a quick pulse just to see if I feel your apical pulse. Okay, I'm going to listen to the bell now. One right here. Okay. Okay, everything sounds really good. I'm not hearing any signs of heart murmurs. Everything seems very smooth. It seems like it's getting to all places of your heart. So I'm going to move on to your breath sounds now.
Okay.
So what I'm going to do is I'm going to do 4 up here, and then I'm going to go to the back and do another 4.
Okay.
I just ask that you take deep, strong, deep breaths, and if you get lightheaded at any time, let me know and we'll take a break.
Okay.
Okay. And deep breath. Okay, deep breath. Okay, I'm gonna go under here. Deep breath. And another deep breath for up here. Okay, still feeling good? Yep. Okay, I'm gonna go to the back. Do a couple more back here.
Okay.
Okay, so another deep breath. Okay. Couple more. Another deep breath. One more deep breath. Okay, that's perfect. I didn't hear any wheezing. I didn't hear anything out of the ordinary. No crackles. It was just a great in and out breathing sound. So while I'm back here, I'm gonna do a quick expansion test. So I'm just seeing if your lungs and your rib cage are moving correctly with your breathing.
Okay.
Okay. So if you take one deep breath for me. Okay, that looked good. Did that hurt at all or anything?
No.
If you just set up or pull out that arm for me, I'm going to take a quick AP diameter. So I'm just making sure that this is half this, which it looks really good. So you can relax. I'm going to actually come to the front and we're going to do one more expansion test on your anterior ribs. So move in and out. Perfect. So now that we have all that done, I'm going to move to your abdomen. So if you would just, well, this is sitting up right now because I'm just going to do a quick check of your jugular and then we'll move to your abdomen.
Okay.
So if you could just lay down for me, I'm going to make sure this is steady. Okay. So I'm just going to check, see if I can see any major pulsations in your jugular veins. So if you would look that way for me. Nope, I'm not seeing any bounding. Look this way. It just looks like a regular pulse. So that's good.
Okay.
Okay. Now I'm gonna move into your, I'm gonna do this, your abdomen. So I have to figure out how to set this down. So if you want to lean up real quick, I don't want to. Okay. Is that comfortable for you?
Yes.
So first I'm just going to look around. If you just put your hands to your sides for me. I'm just going to make sure I don't see any major lumps or bumps, which I don't. Not seeing anything out of the ordinary. Have you had any stomach pains lately at all?
No.
Okay. When was your last bowel movement?
Yesterday.
Did it go okay? Is
Yep.
everything okay? When was your last menstrual cycle?
About 3 weeks ago.
3 weeks ago? Was that normal?
Yes.
Okay. And do you have any pain with like urination or anything? No. Okay. So I checked your stomach out. I'm gonna have you first. It's only gonna be for a couple seconds. If you could hold your breath and lift your head up for a second.
Okay.
I'm just gonna make sure I don't see any major hernias.
Okay.
Okay. I don't see anything out of the ordinary. I'm not seeing any major bulges or anything. So you can relax, you can breathe.
Okay.
So before I feel around, I'm gonna take a couple listens.
Okay.
I'm just seeing if anything in your bowels sounds weird.
Okay.
Let me know if any of this hurts or is tender while I'm doing it.
Okay.
Your tummy is very active. I can hear it. Awesome. So I listened to all your bowel sounds. They sounded good. I heard all the correct gurgling and stuff that I'm supposed to. I'm going to go ahead and listen to some vascular sounds with the other side of my stethoscope.
Okay.
Okay. All of those sound really normal. I don't hear anything other than the normal swoosh I'm supposed to.
Okay.
So I'm going to feel around for your aorta now. Just making sure. Okay. I feel it. I feel the pulsation. Does this hurt when I do this?
No.
Okay, perfect. So now what I'm going to do is I'm going to feel around lightly at first. All I'm feeling for is superficial masses and stuff. I am then going to go in deeper. I'm feeling for lower, more organal masses. So you just let me know if any of this, it hurts at any time.
Okay.
Nothing?
Nope.
Okay, I'm gonna go in a little deeper, just feeling for those deeper masses. Okay. Okay, I didn't feel anything. I'm gonna feel around your belly button. I'm feeling your umbilicus, and that feels very firm. Perfect, so I'm done with the stomach. I'm gonna move down to the legs now.
Okay.
Have you had any issues walking or?
No.
No, nothing in your joints that hurts?
Mm-mm.
Okay. Your feet are chilly, are always this cold?
Yeah.
Okay. Your hands seemed warm, so that was good.
They're cold now.
They're cold?
Yeah.
Okay. I'm gonna check a couple things in your feet. I'm gonna check your capillary refills, which look good. They look under 2 seconds. Your nails down here look very tidy. They look clean. They're rounded. Okay. I'm gonna check for a couple pulses now.
Okay.
I would normally do the femoral pulse, but I don't have to in this instance. I also could take the popliteal one, but I'm not going to in this assessment either.
Okay.
I'm gonna take the tibial pulses and the top of the feet. Okay, those are symmetric. Those are also symmetric too. So now I'm just gonna do a quick range of motion for both legs.
Mm-hmm.
So if this hurts at all either, let me know.
Okay.
So I'm gonna have you lift your legs straight up to the air and then back down. And then if you could put resistance on my arm, okay? And then don't let me push it down. Perfect. If you could go that way, all the way. How far can you go this way? Wow. So I'm gonna have you go this way and don't let me push you any further that way.
Okay.
Okay, the same thing, don't let me push. Okay. This way, against my arm. Okay. And if you could do knee to chest, beautiful. And then if you could do knee to heel, and then as far as you can this way. Also, if you could do a rotation this way. Awesome. I'm gonna move to the next leg.
Okay.
So if you could do the same thing all the way up. Okay. Now if you could pull resistance against my hand, and then don't let me push it down. Okay. All the way out. Can you go to that side? Okay. Can you put resistance against my hand? And the same with this one. Okay. So now I'm gonna have you go knee to chest, and then heel to knee. And if you could go out, and then in. Awesome, so I did your reflexes on your knees already, so that should be good. So you can go ahead and sit on up. Perfect. Are you lightheaded at all?
Yeah,
When you sit up? Okay. I'm gonna do a couple neurological tests now. I'm just gonna do a few.
Okay.
So the first one I'm gonna have you do is I'm gonna have you hold out your hands for me. I'm gonna write something in your hands. Your eyes are gonna be closed, and you're just gonna tell me what I'm writing in your hand.
Okay.
Okay, so you hold out your hands. Close your eyes.
H.
Yes.
S.
Perfect. Okay, you can open your eyes. The next one I'm gonna do is I'm going to have you do the same thing, but instead I'm gonna put something in your hand, and you're just gonna tell me what you think it is. Don't use both hands, just one hand at a time.
Okay.
Okay, so you can go ahead and close your eyes. What is this object?
A pencil.
Okay, I'm gonna put something in the other hand now. What is this object?
A reflex hammer.
Beautiful. So you can open your eyes now. You can relax. The last thing I'm gonna do for the neurological is I'm gonna do what's called a dull sharp test. So if you just hold out your hand for me. So this is gonna be sharp.
Okay.
This is gonna be dull.
Okay.
I'm gonna do it all around your body. You're gonna have your eyes closed again.
Okay.
Just tell me if it's dull, sharp, and where it is on your body.
Okay.
So I'm gonna touch your face too, so just be prepared for
Okay.
that. So close your eyes.
Sharp on my left arm.
Okay.
Dull on my right leg.
Okay.
Sharp on my left leg. Dull on my right arm. Sharp on my left cheek. Dull on my right cheek. Sharp on my left foot.
Okay. That looks really good. so for the remainder of the test, I'm gonna have you actually stand up with me. So I'm gonna check your balance. I'm gonna do some more vision.
Okay.
Yeah, and then we'll be done.
Okay.
So the first thing I'm gonna have you do is if you could stand right here for me. If you could walk 5 steps that way. Okay. Can you walk heel to toe back? Okay. You look very balanced and your gait is very smooth. Your hips look to be in line. I'm going to check that in a minute also.
Okay.
Your knees are very in line also when you walk, and your ankles are also facing forward. So that's great. So if you could scoot up just a minute. Okay. Touch your toes for me. All I'm doing here is feeling for your spine curvatures. I'm also going to be checking your back for lesions and anything while I'm doing this.
Okay.
So I'm not feeling any curvatures that shouldn't be there, like scoliosis or anything. You also don't have any lesions on your back either, which is good. Have you had any issues with your back lately?
No.
Okay. So you're good. You can stand straight up again. I'm going to do a quick hip placement. So I'm going to put my hands right here. If you could turn your torso to one side. Okay. And then the other side. Perfect. Did that hurt at all?
No.
Any pain? Okay. So now I'm going to have you face me. I'm going to have you put your arms like this. Okay, can you push them to the forward? And I'm just going to have you close your eyes and just balance as well as you can. I'm going to be here in case you do get off balance.
Okay.
Okay. This looks good. I should see you swaying just a little bit, which I did, which is normal because your hands are out. So you can put your hands down now. So the last thing I'm going to do is a peripheral test. So what I'm going to do is you can cover whichever eye you want.
Mm-hmm.
And I'm going to go ahead and just make sure your peripheral vision is working.
Okay.
So this eye first. I'm going to come a little closer to you.
Okay.
Just let me know when you can see my fingers, okay?
No.
Now? Okay. And then the other eye. Oops, sorry.
You're good.
Are you ready?
No.
Perfect. So I think that covers all of my assessment. You did great. Do you have any questions for me?
No.
Okay. Then that concludes it. Thank you. I'll see you next time.
Thank you.